You've also said that you are a negotiator. That's one of your big pitches. You're a successful negotiator. And you mentioned a moment ago the NHS doctors. Now, that was one of the most angry, divisive and still not forgotten disputes in the NHS history. Meanwhile, after your presiding over the NHS, for a long time, the NHS experienced the worst winter crisis on its record, the biggest spending squeeze in its history. The waiting lists hit 4 million for the first time, and the flagship targets were missed for years. AE waiting times, cancer treatments, and the waiting list targets all were missed. And you had the junior doctors strike on your watch. And as I say, up and down the country, junior doctors are still livid with you personally. That's not a great record as a negotiator.
Andrew, if I'm Prime Minister, I will be the kind of Prime Minister who takes difficult decisions. I won't be someone who courts unpopularity. When I started as Health Secretary, as you know, I was the longest-serving Health Secretary by the end. I met a father who had lost his son a week old because of a mistake, a medical mistake. And the NHS does lots of wonderful things, but this was a terrible mistake. He had to write over 400 letters and emails before the NHS would tell him the truth about what happened. And that was wrong. And the culture was wrong, and I did take some difficult decisions. But by the end of my time as Health Secretary, nearly 3 million more patients were using good or outstanding hospitals compared to when I started. And yes, we did have enormous pressure in A&Es. We still have pressure in A&E because of the ageing population. And that was why I negotiated an extra £20 billion funding increase for the NHS so that we can employ...
Very, very tough historical
Of course,
squeeze.
but I negotiated that so that we could get the extra doctors, the extra nurses, the biggest increase in modern times of nurse training places and doctor training places up by a quarter. So
let me
that
ask
was a
you
record